Hello everyone and welcome. Today's video is extremely important for diabetic patients, caregivers, medical students, and anyone who wants to understand insulin therapy in a simple and professional way. In this detailed video, we are going to discuss Levemir FlexPen. We will talk about what it is, how it works, its uses, dosage, timing, benefits, precautions, side effects, injection methods, storage instructions, and many other important details. So make sure to watch till the end because this complete guide may help you better understand diabetes management and insulin treatment. Before discussing Levemir FlexPen, let us first understand diabetes. Diabetes is a medical condition in which blood sugar levels become higher than normal. Our body uses glucose as a source of energy. Glucose comes from the food we eat. To move glucose from the blood into the cells, the body needs a hormone called insulin. Insulin is produced by the pancreas. When the body does not produce enough insulin or when insulin stops working properly, glucose starts building up in the bloodstream. This condition is known as diabetes mellitus. There are different types of diabetes. Type 1 diabetes occurs when the body produces little or no insulin. Type 2 diabetes occurs when the body becomes resistant to insulin or cannot produce enough insulin to maintain normal blood sugar levels. Many diabetic patients control sugar through diet, exercise, and oral medicines. However, some patients require insulin therapy. This is where Levemir FlexPen becomes important. What is Levemir FlexPen? Levemir FlexPen is a long-acting insulin used to control blood sugar levels in diabetic patients. The active ingredient in Levemir FlexPen is insulin detemir. It helps provide steady and long-lasting blood sugar control. Unlike short-acting insulin, Levemir works slowly and continuously over a longer period. Doctors prescribe Levemir for both type 1 and type 2 diabetes. It is commonly used as a basal insulin. Basal insulin means background insulin that works throughout the day and night. The purpose of basal insulin is to keep blood sugar stable between meals and during sleep. Levemir FlexPen comes in a pre-filled insulin pen that is easy to use. Many patients prefer insulin pens because they are more convenient and accurate than traditional syringes. How Levemir works. Now let us understand how Levemir works inside the body. After injection, insulin detemir enters the bloodstream slowly. It helps glucose move from the blood into the body cells. As a result, blood sugar levels decrease. Levemir also reduces the amount of glucose produced by the liver. This helps maintain stable sugar control for many hours. Because Levemir is a long-acting insulin, it does not act immediately. Instead, it provides gradual and steady insulin coverage. This makes it useful for controlling fasting blood sugar and maintaining stable glucose levels throughout the day. How long does Levemir last? Levemir usually starts working within 1 to 2 hours after injection. Its duration may last up to 24 hours depending on the dose and the patient's body response. Some patients use Levemir once daily. Others may require 2 doses per day. The doctor decides the timing and dosage according to the patient's blood sugar readings and lifestyle. Who uses Levemir FlexPen? Levemir FlexPen is commonly prescribed for type 1 diabetes patients, type 2 diabetes patients, patients requiring basal insulin support, patients with uncontrolled fasting blood sugar, diabetic patients switching from other insulin therapies. Doctors may prescribe Levemir together with rapid-acting insulin or diabetes tablets. Benefits of Levemir FlexPen. Levemir offers several benefits. One major advantage is stable blood sugar control. It provides long-lasting insulin coverage. It may reduce the risk of sudden sugar fluctuations. Many patients experience better fasting sugar control. Levemir may also cause less weight gain compared to some other insulin types. The FlexPen device is simple and user-friendly. It allows accurate insulin dosing. The pen is portable and convenient for daily use. How to use Levemir FlexPen. Now let us discuss how to use Levemir FlexPen correctly. First, wash your hands properly. Check the insulin label carefully to confirm you are using the correct insulin. Examine the insulin before use. Do not use it if it looks damaged or abnormal. Attach a new needle to the pen. Prime the pen according to the instructions. Dial the prescribed dose. Levemir is usually injected under the skin. Common injection areas include abdomen, thighs, upper arms. The injection site should be rotated regularly. Repeated injections at the same spot may damage the tissue under the skin. Insert the needle into the skin and press the injection button completely. Hold the needle in place for several seconds before removing it. Dispose of used needles safely. Never share insulin pens or needles with other people. Important dosage information. The dose of Levemir is different for every patient. Dosage depends on blood sugar levels, body weight, eating habits, activity level, type of diabetes, other medical conditions. Doctors adjust insulin doses based on blood sugar monitoring. Patients should never change insulin dosage without medical advice. Some patients require Levemir once daily at bedtime. Others may need morning and evening doses. Blood sugar monitoring. Regular blood sugar monitoring is extremely important during insulin therapy. Patients may use glucometers to check sugar levels at home. Doctors may also recommend HbA1c testing. HbA1c reflects the average blood sugar level over the past 2 to 3 months. Monitoring helps doctors adjust insulin doses safely. Hypoglycemia. One of the most important risks of insulin therapy is hypoglycemia. Hypoglycemia means low blood sugar. It may occur if too much insulin is injected, meals are skipped, exercise is excessive, alcohol is consumed without proper food intake. Symptoms of hypoglycemia include sweating, trembling, hunger, weakness, dizziness, headache, fast heartbeat, confusion, blurred vision. Severe hypoglycemia may cause unconsciousness or seizures. Patients should immediately consume fast-acting sugar if symptoms occur. Examples include glucose tablets, fruit juice, candy, or sugary drinks. Family members should also know how to recognize low blood sugar symptoms. Hyperglycemia. Hyperglycemia means high blood sugar. It may occur if insulin doses are missed or insufficient. Symptoms include excessive thirst, frequent urination, dry mouth, fatigue, blurred vision. Persistent high blood sugar may lead to serious complications. Side effects of Levemir FlexPen. Like all medicines, Levemir may cause side effects. Common side effects include low blood sugar, injection site redness, swelling, itching, weight changes, mild pain at injection site. Rare but serious allergic reactions may occur. Emergency medical help should be taken if severe allergy symptoms appear. Storage instructions. Levemir should be stored properly, and used pens should be kept in the refrigerator. Do not freeze insulin. Keep insulin away from direct sunlight and excessive heat. Consistency helps maintain stable glucose control. Levemir in type 1 diabetes. Type 1 diabetes patients usually require lifelong insulin therapy. Levemir may be used as the basal insulin component. Rapid-acting insulin is often added before meals. This combination helps mimic the body's natural insulin pattern. Levemir in type 2 diabetes. Type 2 diabetes patients may start insulin if oral medicines become insufficient. Levemir may improve fasting sugar levels and overall diabetes control. Some patients continue taking diabetes tablets together with Levemir. Pregnancy and breastfeeding. Pregnant diabetic patients require careful sugar control. Doctors may prescribe insulin during pregnancy. Patients should only use insulin under medical supervision. Elderly patients. Older adults may require lower insulin doses. They may have a higher risk of hypoglycemia. Close monitoring is important. Kidney and liver disease. Patients with kidney or liver disease may require insulin dose adjustments. Doctors monitor such patients carefully. Insulin pen advantages. Levemir FlexPen provides several practical advantages. The pen is easy to carry. Dosing is accurate. Injection preparation is simpler. Many patients feel more comfortable using pens than syringes. Common mistakes to avoid. Patients should avoid skipping insulin doses, injecting incorrect doses, reusing needles repeatedly, ignoring blood sugar monitoring, storing insulin incorrectly, injecting into damaged skin. Travel tips for insulin users. Traveling diabetic patients should carry extra insulin, needles, glucometer, snacks, medical identification. Insulin should be protected from heat during travel. Stress and blood sugar. Stress hormones may increase blood sugar. Mental health is important in diabetes management. Patients should practice stress reduction techniques. Regular medical checkups. Diabetic patients should regularly monitor blood sugar, blood pressure, kidney function, eye health, cholesterol. Early detection of complications improves long-term health outcomes. Foot care. Diabetes may affect circulation and nerves. Patients should inspect their feet daily. Any cuts, wounds, or infections should receive medical attention. Insulin myths. Some people believe insulin causes addiction. This is false. Insulin is simply a hormone replacement therapy. It helps control blood sugar and prevent complications. Importance of education. Patients who understand diabetes often manage it better. Learning proper insulin technique improves safety and confidence. Doctors, nurses, and diabetes educators can provide guidance. Hydration. Drinking enough water is important. Dehydration may worsen blood sugar problems. When to contact a doctor. Patients should seek medical advice if they experience frequent low blood sugar episodes, very high sugar readings, severe weakness, vomiting, allergic reactions, fever or infection, emergency situations. Severe hypoglycemia requires immediate treatment. Emergency services should be contacted if a patient becomes unconscious. Long-term diabetes management. Successful diabetes management requires discipline and consistency. Healthy eating, regular exercise, medication adherence, routine monitoring, medical follow-up. Conclusion. Levemir FlexPen is an effective long-acting insulin used to manage diabetes. It provides steady blood sugar control and helps reduce complications. Proper usage, monitoring, healthy lifestyle habits, and medical supervision are essential for safe treatment. With proper diabetes management, patients can live healthy and active lives. Thank you for watching this complete professional guide about Levemir FlexPen. Take care of your health and always follow your doctor's advice.